Hello and thank you for listening to the second season of the iStart PIA Relay podcast series, brought to you by Dementia Researcher. iStart is a professional society and part of the Alzheimer's Association, representing scientists, physicians, and other dementia professionals active in researching and understanding the causes and treatments of Alzheimer's disease and other dementias. In this 5-part series, we have once again asked members of the iStart professional interest areas to take turns at interviewing their colleagues and being interviewed themselves, with the interviewee going on to be the next episode's interviewer. We'll be releasing one of these podcasts each day in the build-up to the Alzheimer's Association's International Virtual Conference to showcase the work of iStart PIAs. Thank you for listening.
Hello everyone, and thanks for joining us. I am Claudio Babiloni. I am a professor of physiology at the Department of Physiology and Pharmacology in Sapienza, University of Rome. I chair the iStart Electrophysiology Professional Interest Area, shortly PIA, in the following. Our work group promotes electrophysiological research in Alzheimer's and the related dementias. Today, I am very delighted to be talking with Dr. Joseph Kane. Hello, Joe. Can I start by asking you to introduce yourself and tell us which PIA you are involved with?
Thank you very much for having me, Claudio. I'm Joe Kane. I'm an academic Old-Age psychiatrist from Queen's University Belfast, and I'm the communications officer for the Lewy Body Dementias PIA.
Okay, thanks for your introduction. Can you tell us what brought you to dementia research and the focus of your research?
Well, I started working in an old-age psychiatry clinic in 2011, and I was immediately taken by it. I really enjoyed working with the patients and with the caregivers, and really struck at how each individual experienced dementia in a completely different way from the next patient. In some cases, dementia was turning the lives of patients and caregivers upside down. They're turning the relationships upside down of married couples who had been together for 50 or 60 years. And around the same time, my granny, with whom I was very close, who had a big part of my upbringing, she started showing the first signs of cognitive decline. And a couple of years later, she was diagnosed with Alzheimer's. Again, over the following years, I saw that her dementia caused ripple effects throughout her entire family and through our social networks. I don't think I realized it at the time, but I think Granny was a big inspiration for me to move towards research and to really look for ways to satisfy the curiosity that was awoken by actually working in old-age psychiatry clinics. And a few years later, I took the opportunity to move to Newcastle, where I researched the clinical epidemiology of Lewy body disorders. And Newcastle upon Tyne is obviously synonymous with Lewy body dementia, so it was wonderful to work there. And while I was there, I did my PhD on the use of MIBG cardiac imaging to differentiate dementia with Lewy bodies from Alzheimer's disease. And I also worked on the Diamond Lewy program of studies, in which we developed diagnostic and management toolkits and introduced them into clinical services. And we were still publishing papers on Diamond Lewy. So I returned to Belfast in 2017, returned to my clinical duties, whilst also trying to develop my academic work. So currently my work mainly focuses on the pharmacoepidemiology of different types of dementia, but I'm also working up a couple of projects on the peripheral manifestations of dementia with Lewy bodies. And so it's been quite a long journey, but I'm very privileged to have worked with some great researchers and to be still involved in clinical work as well.
Okay, so I'm very sorry for your familiar experience. I see that your history crossed your academic and professional choices. And what's the percentage of patients, as your grandmother, what's the percentage of patients with Lewy body dementia?
So the prevalence of Lewy body dementia was one of the main focuses of my PhD work, and that we conducted one of the largest clinical epidemiological studies of Lewy body dementia, and we found that it really represented just under 5% of all cases of dementia. However, we know that detection is an issue in DLB and PDD. We know that sometimes the disease can be expressed in different ways. And when we look at the kind of post-mortem data, we strongly suspect that Lewy body dementia represents 15 to 20% of all dementia. It's just not always expressed and just not always detected. So it's one of the reasons why we always get very excited about the emergence of biomarkers that are useful in the clinical setting. And I suppose overlapping with your own work, we have really helpful electrophysiological biomarkers in that we have polysomnography, which includes EEG and which is an indicative biomarker for DLB, which means that if we have a positive PSG result along with one of the core clinical features of DLB, that it confers a probable DLB diagnosis. And then also EEG has a role in being a supportive biomarker that is a helpful, frequently observed, practicable biomarker that doesn't necessarily confer the same type of specificity to actually confer a diagnosis. So that's specifically kind of prominent posterior slow wave activity on EEG with fluctuations. So any time that we find out about a new biomarker or a new mechanism of detecting and diagnosing DLB better, we get very excited.
Yeah, I really appreciate your answer, because I think that the Lewy body disease PIA is performing a strong work in order to exploit the use of biomarkers, and is a model also for other neurodegenerative dementing disorders. And I think that the dimension of the dementia in the world is really challenging the societies. And I think that the estimation of Alzheimer's Association is that there are about 50 million of people with dementia today. And so the 5–10% of this number is really huge. And EEG biomarkers are low cost and non-invasive and may be used in some countries with low or middle income before to go to neuroimaging. And but you introduced some really interesting issues in epidemiology and in the panel of biomarkers. But what are the hot topics in Lewy body dementia field today?
Well, it's a really exciting time to be in Lewy body dementia research because we are discovering more about biomarkers and about the disease itself. The last few years has seen prodromal DLB emerge as a really major research thing. And there's a lot of exciting work out there characterizing the neuropsychological and the clinical profile of the disease, as well as looking at some neuroimaging characteristics and electrophysiological characteristics. And a lot of the great work is coming out from Italy, of course, also from Newcastle and from Amsterdam and Strasbourg around prodromal disease. And it's all the more impressive when you see the sample sizes and the challenges of actually identifying and recruiting prodromal cohorts. And it's research that's actually making its way into our clinical practice. So we are starting to scrutinize patients a bit more closely for early Lewy body symptoms and thinking a lot more about how we could and should be using the likes of neuroimaging and other tests. Similarly, just as blood-based biomarkers have been making a big splash in Alzheimer's land, it's also an increasingly hot topic in Lewy body dementia. And we're keen to see how all the great work in the likes of neurofilament light applies to Lewy body dementia, particularly as bigger and better characterized cohorts become included in studies. And as I said before, our community has long highlighted the importance of detection and accurate diagnosis, and the likes of a blood-based biomarker in the clinic would be a real game changer. And so we're really excited about that. From a strategic point of view, you touched on it earlier before, in that dementia is a global health issue. And we're really keen in the PIA to start addressing that. Where we see good Lewy body dementia research, we usually see good training and education and practice in Lewy body disease. So one of the things that we hope to do as a PIA is to spread the net, is to widen the community of DLB researchers beyond Europe, beyond the US, and beyond the likes of Japan, to as much of the world as possible. And that in turn will allow us to hopefully recruit bigger sample sizes that we can do, sub-analyses on, and learn a lot more about the disease. So that's been a real focus of our PIA, is making this a global international community, where before it had been something a little more small.
Yeah, this is very interesting. But you are a very active scientist, and so you are in touch with a lot of research group in your area. And so I wonder, what's the added value of Lewy body dementia PIA in supporting your field of research, considering other associations or in the area of Lewy body diseases?
Mm-hmm. Yeah, I mean, the PIA really allows us to look at Lewy body dementia from a global perspective, because it's got this infrastructure, because it's got this large membership, because it's got these great initiatives like this podcast, for example, to really allow us to engage people on a global level. On a personal level, it's been really important to me in expanding my professional and academic networks, particularly as I make the transition from an early career researcher into a more senior researcher. And I think sometimes as an early career researcher, you struggle with the idea of networking. And this PIA gives an amazing opportunity and a real platform for early career researchers to really get involved with researchers from all over the world and some of the real giants in the field. When, like me, if you're part of a really supportive and interesting group, which is slightly outside the major DLB research groups, it can be difficult to stay abreast of some of the exciting research which is coming out, and it can be quite difficult to forge new collaborations and relationships. And my primary motivation for joining the PIA was to support that area of my work. So I got involved with some of the working groups. I got the opportunity to get my name out there a little bit more, to publicize and share my research a bit more. And then as I got more involved in some of the working group projects that we have going on, in particular the consortia working group, it meant that I've really been able to engage a lot more with the community than I was before. It's also helped me recognize how, as someone who is in clinical services, what I should be doing and how I should be doing it when it comes to establishing a DLB data set and maintaining a DLB registry that is capable not only of producing good research locally within our lab, but also capable of contributing to some of these multinational, multi-center consortia and really contribute to this global effort. And then obviously, since I've been appointed to the executive committee, which gives me the great opportunity to get involved in initiatives like this podcast. So I think looking forward to the future, the PIA is really keen to engage ECRs and support ECRs as much as possible as we continue to cultivate our community.
Okay, yes, but I think that, of course, the interaction and the networking and linking among research groups is important in all areas of dementia research. So my question is if it's specifically important for Lewy body dementia research.
With respect to ECRs,
Yeah,
early career
yeah, yeah.
researchers. Yeah, I think so. I think, I think that there's two different perspectives to it. I think, first of all, of course, we need the research leaders of the future. We need that, and that takes an awful lot of time and an awful lot of building things like networks and relationships. I think in a more immediate sense, however, we want to know as a PIA what early career researchers actually need right now. What do we need to get you to the next stage? What do we need to help you with your work? And in order for us to know about that, we need as many people involved as possible. So you do not need to be an expert in Lewy body dementia to join this PA. You don't need to be a clinician. You don't need to be any particular level. We want to hear from people of all different levels. And I think another reason why it's important that we support early career researchers going forward is because, you know, Lewy body dementia does have its idiosyncrasies and its unique aspects. And we want to keep young, talented researchers of all backgrounds in the Lewy body dementia field rather than encourage them to look towards some of the other dementia fields that maybe traditionally have had access to different funding streams and other expertise. So we, like I said, we really want to cultivate not only a community, but a kind of pathway for our younger researchers to make it from early career to more senior levels.
Okay, I see that you are inviting people to be in touch with your PIA, but maybe they may be interested in know a little more about the PIA. What is a PIA? What's your committee, for example, and what's the general organization of a PIA?
Sure. Well, we're a relatively young PIA. We were formed in mid-2019, and we have a relatively small executive committee. So we have a chair and a vice chair. That's Professor Dag Osland from King's College London and Stavanger University Hospital, and Dr. Jim Leverins from the Cleveland Clinic in the USA. We also have Professor Laura Bonanni from the University of Katy Pescara. She is our programs officer, as well as Dr. Bradley Bove from the Mayo Clinic in Rochester. So a real group of giants in the field. So anyone that's interested in Lewy body dementia will know the impact that these researchers have had on the field. And then there's me as communications officer, and we're supported by staff from the Alzheimer's Association, in particular the wonderful Jodie Tittner. So we have regular meetings. We in particular run 3 working groups that are focusing on different projects. So first of all, we have one focusing on DLB consortia, one on prodromal Lewy body dementia, and one focusing on clinical trials. And each of those 3 working groups holds a virtual meeting every 3 months or so. And many of our 60 PIA members will participate in all 3 of those groups. Some of them will participate in 1, some of them in 2. So this year, the groups have been working together on projects outlining really where we stand globally with Lewy body dementia research. Fabrizio D'Antonio, who I know you've worked with, Claudio, and I have been working with the consortia working group, including yourself, of course, to gather information on DLB consortia around the world, what type of data they collect, which centers they include, and so on. And it's been a really exciting project to work on because I've been sending emails on a Monday afternoon, and by the time I wake up on Tuesday morning, I have, replies from, from Katy, as well as, China and India and Colombia. So it's been really exciting in that sense. Another of the working groups, Federico Rodriguez Porcel, has been working with the trials method group to really do a systematic review on the current outcome measures employed by Lewy dementia trials. Our expectation eventually being that novel, bespoke Lewy body dementia outcome measures are likely to be required in the future, as well as harmonization of existing methods. So these projects are all going on in tandem, and they are all available for anybody in the working group and anybody in the PIA to participate in. And it is a very genuine, collaborative, multidisciplinary, multinational effort. And the meetings are really convivial and relaxed, and it's not the type of meeting whereby an early career researcher, for example, would be afraid to put their hand up and ask a question. It's genuinely collaborative, and it's very exciting work, and that's one of the reasons we really want early career researchers to join. And so we will continue to adopt that structure in the kind of years ahead, and we'll also be looking towards other initiatives that engage people a bit more, like this podcast, like networking sessions, and other activities like that.
Okay, so I admit that I have a conflict of interest because I am also a member of Lewy body dementia PIA. Okay, but I see that you have been very convincing, and probably many early career researchers who are listening may be interested in being involved in the PIA initiatives. So practically, how can an early career researcher become a member of LBD PIA?
Well, the first thing to do is, with your iStart account, is to sign up for the PIA if you haven't already done so. As I said before, you don't need to be an expert, you don't need to be a professor, you don't need to be a prolific researcher. You just need to be interested in working collaboratively and enthused at advancing the field. And so we welcome people from all backgrounds. In particular, you're right, I do really want to encourage early career researchers to take part, not only because they're the future leaders of the field, but also because we want to know how we can improve the work of the PIA and the best cater for early career researchers. So once you join up for the PIA, you'll be sent invitations to our virtual meetings for our working groups. As I said before, they're a lot of fun, and they're very genuinely collaborative and cordial, and they're productive as well. The projects that we've been working on this year have already produced one manuscript which has been submitted, and we're well on our way towards submitting a second. So it's a great opportunity for researchers to be involved in projects like that. If you're still undecided about whether or not you want to join, we're holding a few different events over the next few months. On Wednesday, the 21st of September, we're having our scientific session. Sorry, Wednesday the 15th of September, we're having our scientific session, in which we'll be welcoming early career researchers and more senior researchers from all around the world to present their new Lewy body dementia research. Before that, in July, if you're attending AAIC, we are holding a preview session and a networking session to go along with the AAIC schedule. Again, this is a great opportunity to meet some of the executive committee who are very approachable and very friendly and very, very keen to support researchers of all levels. And that should be a fun opportunity for us to highlight some of the posters that we're looking forward to seeing and some of the oral presentations that we're looking forward to seeing. So if you're still on the fence, if you're still undecided, please attend those events. And if you'd like, by all means, get in contact with me as well, and I'll try and persuade you more. But I genuinely can't encourage early career researchers enough to get involved in this PIA.
So I think that it's really exciting to be part of these initiatives in the coming months. You introduced several initiatives, the podcasts, the work groups working on the guidelines to linking research, local research. There are several initiatives in front of us, but could you emphasize a couple of goals most important for your PIA in the coming months?
Certainly, in terms of the next plans for the next year, I think we'll be looking to really build on the momentum that we've gathered over the past 12 months, particularly with respect to widening the net of Lewy body dementia research. So we really want to involve and engage researchers and clinicians, particularly from regions that haven't previously been active in the field. We want this to be a global community. We want people from as many walks of life as possible to join us in that respect. We want to think of the best ways that we as a PIA can support people that are thinking of starting up new groups, people that are thinking of contributing to consortia. And I think one of the things we have to do is figure out how we can share data with each other more effectively and harmonize that data much more effectively. The work of the clinical trials group will hopefully create a standardized battery of outcome measures, again with the idea of harmonizing global data as much as possible. And then from a strategic point of view, we really want to grow the membership of the PIA membership itself. I know you've got split loyalties, but the Lewy body dementia PIA is the best PIA. And I think, and everyone needs to know that. And we've been delighted with what we've been able to achieve thus far. But with a larger, more diverse group, we think we can achieve even more. So I think another type of thing that we'll be looking towards is to collaborate with some other PIAs, particularly, of course, the electrophysiology PIA. There are a lot of overlaps and a lot of overlapping themes between our respective themes. So we want to explore that as well. And then finally, we will really look towards some of the opportunities that iStart offer in terms of some of these great mechanisms that they have for engaging as many people as possible and as wide a range of people as possible. So things like the journal clubs and meet the author sessions, we think are really great initiatives. And whilst we don't have dates in the diary yet, I would encourage people to look out for events that we'll be holding over the next year. Finally, we'll be on the hunt to get early career researchers to participate in these events. So all the more reason for them to join the PIA.
Okay, and about you, I suppose that your group will be presenting some new findings in the upcoming Alzheimer's Association International Conference in July this year. And can you give us some anticipations about your fresh findings?
So I'm not unfortunately presenting at AAC this year because I'm between projects and having moved labs as well. But I know for a fact that the Lewy body dementia PIA will be very well represented in both the oral presentations and the poster presentations as well. We are in the very final stages of putting together our scientific session, which will be a designated session specifically for Lewy body dementia. And again, that promises to show some of the most interesting research from researchers of all backgrounds. So keep an eye out for that as well. So I'm not presenting, but I'll definitely be attending, and I'll definitely be highlighting in our preview session some of the presentations that I'm most looking forward to attending.
Okay, thanks a lot. I think that we have to go to the end of this conversation, but my final question is what advice would you give to aspiring dementia researchers about the direction of the most promising research, and what's the perspective of a younger researcher in LBD PIA?
I think the best advice that I could offer anyone in the early stages of their career is to be confident and show their enthusiasm and be very willing to get involved. Sometimes as an early career researcher, you feel reluctant to speak to people who you perceive as the giants in the field. You can feel a bit afraid that people will judge you, or people will not think that you're worth their time. That has been the polar opposite of my experience, in particular with the Lewy body dementia PIA, and the Lewy body dementia community in general. Even though we have some absolute giants, some incredibly accomplished scientists and clinicians, they're always willing to chat. They're approachable, they're friendly. So my main piece of advice would be to abandon shyness and abandon your reservations and talk to these people. And again, to plug the PIA, I think the PIA is a great opportunity to do that, because it can be a meeting of 30 people from around the world of all different backgrounds, and yet it's a relaxed and cordial enough environment that questions and contributions from early career researchers are welcome. So that's the main thing I would do, is really to get involved and don't be afraid.
Okay, thanks a lot, Joe, for taking time to join us today. Thanks a lot.
Thank you very much, Claudio. I look forward to hearing your interview and to working with you in the future as well. Thank you.
This is the last in the second series of the Relay shows. We hope you've enjoyed listening. iStart PI Ears are a great way to expand your network, to find new collaborators, and we hope these podcasts have inspired you to become involved. You can find profiles on today's panelists and information on how to get involved in iStart on our website at dementiaresearcher.nihr.ac.uk and also at als.org/iStart. We're really looking forward to next week's AAIC conference, so if you haven't already registered, visit als.org for more information. Finally, once again, please remember to like, subscribe, and leave a review of this podcast on our website and in your favourite podcast app. Thanks for joining. Come back next week to catch our AAIC conference daily roundup shows, where we'll be sharing our favourite moments from the conference.
Brought to you by dementiaresearcher.nihr.ac.uk in association with Alzheimer's Research UK and Alzheimer's Society, supporting early career dementia researchers across the world.
Hello, this is Adam Smith. I'm just dropping into the podcast stream to ask you a favour. Dementia Researcher has been nominated for a People's Choice Podcast Award, and it would be fantastic if you would take a moment to vote for us. You'll find the link in the text below the podcast, but if you visit podcastawards.com, register an account, and you'll find Dementia Researcher in the Science and Medicine category. Choose us, hit submit, job done. Dementia Researcher is a real passion of mine. I so enjoy producing the podcast and occasionally hosting as well. All of our guests give up their time freely, and I think this would be a fantastic way to recognise their contribution and to help put important dementia research on the map. So please, if you have a moment, it would be fantastic if you could take the time to vote. Thank you very much for listening. And again, click the link in the text below or go to podcastawards.com by the 31st of July. Thank you.